Hi, today I'll be dealing with a topic which is related to diabetes. In fact, this will be the second in my series in diabetes. Now, the topic for today is diabetes mellitus, how to lower your HbA1c level. In short, it is also called A1C. In fact, for my first episode, you can refer back to the link that I have provided in the description box. Now today I'll be dealing with HbA1c. Sugar from food makes its way into your bloodstream and attaches to your red blood cells significantly to a protein called hemoglobin Hb. Now this is the pictorial representation of how it happens. A1C level is a measure of how much sugar is attached to your red blood cells. HbA1c refers to glycated hemoglobin. It develops when hemoglobin, a protein within red blood cell that carries oxygen throughout the body, joins with glucose in the blood, becoming glycated. This can help determine if you have diabetes or prediabetes and can help inform you how best to manage it. How to lower A1C level? What is the A1C test and what does it measure actually? The A1C test is a blood test that screens for diabetes. The test provides information about a person's average level of blood sugar over a 2 to 3 month period before the test. If you have diabetes, it can give doctors a picture of whether treatment is working and how well you are managing the condition. What is the A1C test and what does it measure? The A1C test measures how much glucose is attached to hemoglobin. This is the protein in red blood cells. The more glucose attached, the higher the HbA1c. The number is reported as a percentage. If the percentage is higher, so are your average blood glucose levels. A higher number means your risk for either diabetes or related complication is higher. Although A1C is the gold standard of diabetes diagnosis, many clinical conditions can affect A1C, including iron deficiency anemia and other blood disorders that affect red blood cells. A doctor may recommend you take different tests to ensure an accurate diagnosis. A1C can test for type 1 and type 2 diabetes, but not for gestational diabetes, which is pregnancy related diabetes. What is the A1C test and what does it measure? Continuing with it, if you have diabetes, you still need to test blood glucose level regularly with a finger stick glucose test. Why? Because the A1C measures is an average for last maybe 2 to 3 months, but a finger stick glucose test actually measures your daily level. The A1C measure may not capture intense high and lows on its own, which can be tested with a finger stick glucose test. Some benefits, however, of the A1C test include it doesn't require fasting. It gives an average of blood sugar level over a period of weeks to months. And in fact, the doctors relies a lot on this HbA1c level nowadays to actually diagnose diabetes and manage it. It can be done at any time of the day. According to the National Institute of Diabetes and Digestive and Kidney Diseases, A1C measurement can indicate whether you have diabetes or pre-diabetes. Now, for a normal level, it is actually equal to 5.6 or less than 5.6. In this reading or with such kind of a reading, the patient is considered to be a normal patient, a non-diabetic patient. However, if the reading of HbA1c ranges from 5.7 to 6.4, the patient is in pre-diabetic level. It is called pre-diabetes. And if the reading is 6.5 and beyond that, 6.5 plus, then the patient is of course a diabetic patient, declared diabetic patient. How to lower A1c level? You can lower your A1c level with changes to diet, exercise, and other habits. For some people, medication may also help. Diabetes is a serious chronic condition that can lead to many complications, but there are ways to manage your blood sugar level that may reduce your risk. A doctor may test your A1C level if you have or are at risk of developing type 2 diabetes. Early diagnosis and treatment may help prevent diabetes complications. Here are 9 ways to lower your HbA1c, or in short what is called A1C level. Number 1, make a food plan. Eating certain foods may help lower your A1C, so you may want to make a plan and stick to it. A few important strategies include: make a grocery list. When trying to fill your basket with nutrient-dense foods while minimizing sweets, having and following a list can help you avoid impulse purchases. Note down impulse purchases, which all of we are tempted to. If you are trying out new recipes, a list can help make sure you get home with all the right ingredients. Meal preparation ahead of time. When you are fixing a nutritious meal, you can save time by doubling the recipe so you have another meal readily available later in the week. Build in flexibility. Plan to give yourself options before you need them. That way you are not searching for a fallback when the cupboards are bare and your stomach is rumbling. Number two, measure portion sizes. Now, this is exactly what the portion size of a diabetic plate should be. If you can just watch it out, and the details are here. Controlling portion sizes may also help reduce your A1C. Helpful practices can include: get familiar with the appropriate portion size. You don't have to measure every food you eat by the gram to learn to recognize and make a habit of thinking about what's right size portion. Use smaller plates at home. This is important. Use smaller plates at home for portioning purposes. Opting for a smaller plate may help limit portion sizes. Avoid eating from a bag. If you are having a few crackers, pull out a reasonable serving, then put the rest back in the cupboard for later. Be mindful when going out to eat. Restaurant meals can contain large portion sizes. Rather than ordering an entree that may contain more food than you need, you may want to ask a friend if they will split something with you, or you can plan to take half home to eat later in the week. Track carbohydrates. The appropriate amount of carbohydrates varies from person to person and is worth discussing with a doctor. But carbs can be easy to overdo if you are not keeping a track. It can be helpful to maintain a food diary or use an app to keep track of your carb intake. Starting out, you may have to take some time to look at nutrition levels. With practice, this will become a quick and easy process and will help you get a sense of which food are must or most carb heavy so you can adjust accordingly. Plate method, also called the diabetes plate method. Underline the word diabetes plate method. The idea here is to simplify your mealtime calculation while eating the right food in the right proportions. Picture a plate that's less than a foot in diameter and divide it into quarters. Divide the plate into quarters. This is exactly how it goes. Half of what's on the plate, that is 2 quarters, should be low carb vegetables. I repeat, half on what's the plate, on the plate, that is 2 quarters or half of the plate should be low carb veggies. Namely, there may be to choose from including broccoli, cauliflower, carrot, peppers, mushrooms, and cucumber. This can include anything leafy like lettuce, cabbage, spinach, and so on. The next quarter of the plate should be lean proteins. This can include fish, chicken, eggs, shellfish, cheese, tofu, and lean cuts, or pork and beef for those who actually prefers or have a food habit of going for pork and beef. The last quarter of the plate goes to carbohydrates, carbs. Carbs can include grains like rice and whole grain bread, as well as fruit and starchy vegetables like potatoes. You can apply the same proportion and ideas behind the plate method to foods that don't lend themselves to being divided across a plate, like a sandwich, for instance. Number five, have a realistic weight loss goal. Set yourself up to success. It's important to be practical because a slow, steady approach to weight loss tends to get the best results when it comes to keeping weight off. This is important. Slow, steady approach, a pound or two a week at most. It's also worth noting that results don't have to be drastic to meaningfully improve your health. Experts say even 5% can make a difference. This means if someone at 180 pounds adjusts their exercise and food habits and works their way down to 170 pounds over a few months, the resulting health benefits can be worthwhile. Talk with a doctor about what weight loss goal makes sense for you and how best to work toward it. Number six, exercise plan. Increasing your activity level can help you get A1C level down for good. You may want to start with a 20-minute walk after lunch. You may be able to build up to 150 minutes of extra activity a week. Get confirmation from a doctor first before you increase your activity level. Exercise can affect your blood sugar levels, and depending on other health conditions you may have, a doctor may recommend a safe starting point. Being safely active is a key part of reducing the risk of developing diabetes. Remember, any exercise is better than no exercise. Even getting up for 2 minutes every hour has been shown to help reduce the risk of diabetes. Take medications. Taking prescribed diabetes medications can help manage your A1C level. Medications that lower fasting blood sugar will also lower your HbA1c level. Some medications primarily affect your blood sugar after a meal, which are also called postprandial blood sugars. These medications include sitagliptin or repaglinide and others. While they don't significantly improve fasting glucose values, they still help lower your A1C level because of the decrease in post-meal glucose spikes. Supplements and vitamins. Some supplements may improve your A1C level. This can include aloe vera and chromium. Aloe vera is a succulent that may lower fasting blood glucose and hemoglobin A1C according to a 2022 research. However, additional studies are needed to test its long-term effects. Chromium, a mineral found in vegetables like potatoes and mushrooms as well as oysters, may lower A1C in people with severe insulin resistance and less glycemic control. But some studies show inconsistent or mixed results. As a result, the American Diabetic Association doesn't recommend chromium supplementation in people with diabetes. Stay consistent. Lowering your A1C level depends on making changes that become habits. The best way to make something second nature is to keep doing it consistently. Particularly where eating patterns and exercise are concerned, slow, steady progress tends to deliver the best long-term results. Now that was about diabetes and controlling HbA1c. As I said, this was the second in series for diabetes. If you happen to miss the first episode and you want to go through it, you can refer to the link that I have provided in the description box. Thanks for watching. Hope this educational info was useful to you. For more such informative, relevant, useful, helpful, practical tips for you and your near and dear ones, please subscribe to my YouTube channel. The link or the click button is provided at the bottom screen right hand side of your screen. Please click on the button to subscribe and requesting you to please share and share your views. Before I wind up, I always say that laughter is the best medicine because it comes free of cost, and I sign off today with today's laughter dose. Well, that was perhaps a trust deficit. Thank you for watching. See you next with a more exciting topic which will be related to your health and your near and dear one's health. Thank you. Good night.